Good morning and welcome back to Fourth Trimester Voices. My name is Dr. Chua. I'm your host. This week is Black Maternal Health Week. It runs from April 11th through the 14th. And on today's episode, I just want to have a real conversation about something that's affecting a lot of women. And it's affecting a lot of women and a lot of health outcomes out there. And that is misinformation in digital spaces. Why am I talking about it this week? Well, here's the reality. As Black women, we're often underserved. We often feel dismissed. We're overlooked in the healthcare system. So we turn to TikTok, we turn to YouTube, we turn to Facebook groups, we turn to Instagram to find answers. And while there's so much information that is good out there, there's also a lot of misinformation. There's a lot of noise, and that noise can cost us our lives and can make us make very bad decisions. And so today I just wanted to pause and take the opportunity to record this episode about misinformation. So let's talk about the facts. I always talk about this on all my podcasts, but Black women are 3 to 4 times more likely to die from pregnancy related causes. We're also more likely to be misdiagnosed or dismissed when we raise concerns. This leads many of us to seek validation or care from online spaces. Here's my issue. The internet is not regulated. Social media doesn't fact check. And many creators, even though they mean well, are sharing content that is flat out wrong and harmful, especially when it comes to pregnancy, birth, and postpartum. So let's just give you some examples that I have seen. So I am definitely active on the internet streets. And so I get to be in groups, I get to see things, I get to listen. And there's so much misinformation out there that makes me cringe and makes me concerned as a physician, because I know at the end of the day, as Black women, we have higher risk of complications. And so we have to be very careful about what information we take in. One example that I have seen about misinformation that is out there is that if you get diagnosed with preeclampsia, you should refuse magnesium. You should refuse to go into the hospital because they're going to pry the baby away from you. They're going to hold you down. You won't be able to move. They're going to put a catheter in you. There's a lot of fear mongering out there. And so a lot of women who may have elevated blood pressures and are told, hey, you have preeclampsia, there's a lot of information out there that is saying this is the supplements that you can take to treat it. You don't need to go in, because if you go in, you're going to increase the interventions, they're going to induce you, you're going to end up with a C-section. And what these people are failing to understand is that we are dying from preeclampsia. We are dying more than any other group from preeclampsia. And so this is not the time to stay home if your blood pressure is elevated, because that can cost you your life. And so that is one big lie that I have seen out there is if you have high blood pressure, preeclampsia, refuse to go to the hospital, refuse to go be admitted. And terrible things have happened to moms when it comes to these decisions. The red flag that I see when it comes to this is that a lot of people are oversimplifying a diagnosis that really requires medical treatment and evaluation. And so you're taking this really complicated thing and you're bundling it down into something so simple that moms don't go into the hospital because all they want to do is interventions. And so just stay at home, take your own tablets of magnesium, take these things, drink some of this tea. That's not okay. Some people may make it, but some moms may die as a result of listening to this information. Another thing that I have seen is all OBs are part of this evil system and avoid them at all costs. There's a lot of villainization out there of my obstetric colleagues. And I really hate this because my obstetricians really are out here doing the work when it comes to maternal health outcomes. And so they're at the forefront of the research that is looking up these things that are killing women. They're at the forefront of policy and making sure that women are staying healthy. They're also operating, they're also taking care of non-pregnant women. And so there's a lot of stress that comes with the job. And so, some people may have their experiences when it comes to their interactions with well-being, may feel that maybe someone was cold to them, or maybe that interventions were pushed to them. And that experience shouldn't villainize the entire system because let's be real. The majority of women are going to deliver their births with obstetricians. And there are terrible stories out there that happen. They're terrible experiences, but they're also amazing life-saving stories. Obstetricians have literally saved moms from the brink of death, taken them to the operating room, pried the baby when their life was at risk. So vilifying obstetricians, OBGYNs, is not the solution. And unfortunately, this rhetoric shows up a lot in holistic birth spaces. And while I get the frustration with medical racism, people are really swinging to the opposite end of the spectrum, and now they're risking their lives. They're avoiding all prenatal visits. They're declining necessary interventions without guidance, especially for Black moms who are facing higher risks. Mistrust without nuance. We need to have a balance, right? We need to have a balance of advocacy and with access to care. We need to have a balance of advocacy with access to care. So I really hate that my OB colleagues are villainized because this rhetoric needs to stop. We need them, right? They do a lot of things that a lot of holistic birth spaces do not have. Okay. Let me think. Is there something else? I mean, there's so many examples. I think you can treat urinary tract infections like UTIs or mastitis with herbs alone. Mind you, you can really get rid of mastitis before taking antibiotics. There's a lot of pumping you can do, breastfeeding. There's a lot of medications or supplements that you can take to relieve the blockage and get to a point where you have relief. However, if you're having elevated fevers, your blood pressures are low, your heart rate is high, you're having severe pain, you are looking really sick, you can't stay home. You cannot stay home. Natural remedies cannot replace evidence-based life-saving medications. So please, if it gets to a point where you are sick and ill appearing, there's a point that garlic will not work. There's a point that you need antibiotics. There's a point that you may need medical treatment. Why? Because there are complications to these things. With mastitis, you can get an abscess. With a urinary tract infection, you can have a bloodstream infection. And so there are limitations to supplements. There are limitations to herbs. There's some things that you have to go into the hospital to get medications for. Okay. So those are just some examples. I want to say what you should be asking before actually asking advice online. If you have a problem and you feel like you don't have anywhere to get your information, right? Where's the first place that you're going to turn? Should you go online? Should you go use ChatGPT? Should you go on Google? Where is that first place? Right? And so I want to just talk about how you can evaluate content for its validity, for its evidence-basedness, if that's a word. And so the way you can do this is number one, who is saying it? Right? Who is saying this information? Number two, do they list credentials? Are they licensed professionals? Or are they just speaking from personal experience? Number three, what is their tone? What is their tone? Are they fear or shaming you to get clicks? Are they offering balanced, compassionate education? Are they willing to say, this isn't for everyone, right? I had a home birth, but this is not for everyone. I used garlic, but this is not for everyone, right? Are they willing to say that this is treatment is not standard for everybody, right? Real professionals are going to speak with nuance. They don't push a one size fits all answers. And are they encouraging you to seek medical care? The best educators out there, doulas, therapists, nurses, OBs, any of those people, they will tell you when something is out of their scope. In my practice, oftentimes I have people refer people to me and they're asking me things about, in my practice, I have people who refer patients to me. And they're asking me questions about it may be about their pregnant women or maybe something surgical. And I am not an obstetrician. I'm an emergency room physician who does postpartum care. And when something is out of my scope, I don't pretend like I know what's going on. I don't try to treat that thing because that can get me in a lot of problems. I refer that person to somebody who can help them. And so I am very careful when I give out information that I am not saying my solution fits every size, and I'm not commenting on things that are outside my scope. And a lot of people out there are commenting on things based on their own individual experience, but don't have an experience maybe treating women. They don't have the educational background. They may not have really the evidence to support what they're telling you to do. And so you really have to listen to this. Using digital media can really be a dangerous thing for moms. So, knowing this as a consumer, how do you exactly use it in such a way that you can get the information? And I know a lot of times when moms are going online, they're really desperate for information. And so, I want to say if you're going to run to TikTok or Facebook or Instagram to look for information, I want you to make sure that you are following people who are going to give you the information that you need. Social media is not all bad. In fact, it's good because it could be one of the most powerful tools. You could be going through something and you type in your experience and you see that a mom went through similar experiences. And so it may give you an answer that you can bring to your doctor and you can say, hey, listen, I saw this thing and this mom was struggling with this and she was diagnosed with this. What are your thoughts? And so it can be a powerful tool, right? So I would advocate that you need to follow people who are licensed and who are culturally aligned. You need to use platforms, right, that are going to help get the information that you need. For example, there's certain platforms out there that give evidence-based information. Let me give you an example. There's some breastfeeding groups that are really high on evidence-based care. And so you'll find them out there. There's also Mayo Clinic. Mayo Clinic is online, and Mayo Clinic is always going to give you a good answer to your question. And then you want to go to follow, physicians or follow doulas who follow evidence-based care. You want to follow lactation consultants that are going to give you a full rounded picture, right? They're not just going to tell you breastfeed, breastfeed, breastfeed to the point that if your child is starving, they don't want to give your baby formula. So there are limits to this thing. You have to really understand how to sift through this media to be able to give you the answer. Now, some people love using ChatGPT. It's the ChatGPT era, it's the AI era. And so a lot of people are going to ChatGPT and trying to get information. Here's the thing, ChatGPT can lie. ChatGPT is not going to give you the right evidence all the time. With ChatGPT, you have to be very clear how you use it, right? You want to make sure that you're asking it and you're giving it prompts that are actually going to give you the proper information. So I wouldn't go in there asking for specific medical conditions, right? Maybe you can ask ChatGPT to explain something. So, hey, ChatGPT, I was just diagnosed with preeclampsia. What does that mean? Say it in lamest terms so that I can understand. That's a great way to use ChatGPT, right? I wouldn't say go on ChatGPT and say, ChatGPT, I have garlic that I'm going to use to treat my UTI. How can I use this garlic in such a way, right? I'm just making up an example. I don't exactly know if that makes sense, but there's just certain things like when you ask ChatGPT, you want to make sure that it's very specific. You can ask it to break down difficult to understand medical information, but don't look for health advice, right? If you go on ChatGPT and say, ChatGPT, I have this rash on my face and I'm pregnant. What could it be? Like, that's not a good use of ChatGPT. Okay. And then another thing that you can do when you come across information on TikTok, Instagram, Facebook, save it. Save it and then go to your doctor, talk to your doctor or your midwife and ask them, hey, is this true? Is this content true? Right? And then if you have a question, if you have a concern, if you're in the throes of a problem that's happening in the pregnancy period or postpartum period, and you need to get to somebody quickly, please, you can always utilize telemedicine. If you're in Atlanta, Georgia, I provide quick assistance to moms who just have a question to ask, and they can call me, email me, and this is a way that they can bypass all the misinformation that's happening out there. All right. So, when you're pregnant or you're postpartum, your intuition is powerful. However, information sometimes is a blur. There's a lot of conflicting information out there. And so it's hard to see what is true and what is not. And so you need to make sure that your sources are solid, that your information is solid. So here's what I want you to remember. Number one, don't trust everything you scroll past. Number two, pause, verify, ask before acting on medical content. Number three, build a team online and offline. If you're going to get your information off online, take it to your OBGYN, team up with your OBGYN or your midwife, talk about it because all of this information needs to be proven to be true. And you want to have this conversation with your doctor about why or why not, why or why it is not true, right? And knowing this is going to keep you informed and keep you safe. If you are feeling overwhelmed or unsure, please call me. I offer urgent care via telemedicine or in-home visits in Atlanta, Georgia. I offer postpartum visits for moms who need someone to listen, evaluate, or advocate. Our bodies are going through so many changes. You don't know what is real. You don't know what is normal, what is abnormal. And so we're rushing online, and I just don't want that for you. I don't want that for you. And so please find me on Instagram at Dr. Choa. Message me. You can go to my website, emcare2u.com. I really want to make sure that we are getting the support that our Black mothers need because it is more about, I want to make sure that our Black moms are getting the information that they need and deserve, right? We deserve to feel supported. We deserve to be respected. We deserve to be in truth. There's a lot happening out there. The statistics are not looking great. And so we have a distrust of our system, of our OB colleagues, of our less holistic spaces. And this can really lead us to making not so great decisions. And so there is room for holistic care. There's also room for evidence-based care. Let's not replace one over the other. These need to go hand in hand. Holistic care with evidence-based care is really, truly important. All right, reach out if you need me. This is the end of today's episode. My name is Dr. Choa. Take care. Are you navigating pregnancy and postpartum alone? Are you feeling overwhelmed by the lack of support? You're not alone, and you don't have to do this alone. With EM Care to You, I offer personalized in-home and telemedicine support designed to guide moms through the challenges of the postpartum period. Whether you need total on-call services or periodic check-ins in the home, I help women recognize warning signs and I support you as your advocate, and I am here for you the entire step of the way. I want to create a postpartum plan that's all about you, your health, and your recovery. Follow me on Instagram at Dr. Choa for tips, resources, and there you'll find a way to book me. All right? DM me or email me if you have any other questions. Other than that, I'm on all social media platforms under Dr. Choa, DrChowa. Let's build a village of support. Let's give you the hope that you need to get through this period of time. Take care.